Welcome to ACR Health's Nutrition Health Education Program. My name's Shirley, and I'm one of the educators that works for the program. This month, I want to talk to you about HIV and AIDS and how it relates to your nutrition and your diet. First, I'm going to start by sharing my screen because I do have a PowerPoint and a video that I want to share with everybody. Okay, so nutrition and HIV/AIDS. So really what I want to talk about today is how your nutrition and your daily diet can help alleviate some of the symptoms that come with HIV and AIDS, or come with the medications that you take daily to deal with these things. So I do want to start with a video, and this is just discussing what HIV is, how it gets into our body, and what it does to our body. And from there, I'll talk about what our nutrition can do to help us with some of these things. So basically, once HIV gets into our body, it starts changing very rapidly so that your white blood cells, the T cells that you get checked when you check your CD4 count, those cells eventually don't recognize it and they allow it to hang out and to attach to them.
And eventually enters the cell where it releases two viral RNA strands with three essential replication enzymes. Because HIV is a retrovirus, the RNA is transcribed into DNA, presenting here by an enzyme to release the cancer. This DNA is
So basically what happens there is that once your white blood cells let the HIV in and allowed it to share its DNA with it, it then tricked it again, and now your own white blood cells are copying the DNA of HIV and passing it out. And that's how it spreads so quickly, by changing so often. So AIDS is really, excuse me, AIDS is really just a title that a person receives when their CD4 count drops below 200. Basically, that means that your body has become unhealthy and you now have this title. The good news is that a person can very easily bounce back by remaining medically adherent. So you may have the title of AIDS, but that doesn't often make people any more healthy or unhealthy than any person with just an HIV diagnosis. So ARV therapy, antiretroviral therapy, is basically the fancy name for the typical medications that any person with HIV are on. Also, I wanted to pause and give everybody the good news, which is that Martin Shkreli, that man that made HIV medicine so expensive, did eventually end up going to jail. Thirdly, I wanted to pause and mention PrEP. If you've not heard of PrEP before, it is basically a medication that a person takes every single day, an HIV negative person. They take it daily and it helps them stay HIV negative. So it's for people who are either dating or sleeping with people with HIV, or maybe they are just having a lot of unprotected sex. Maybe it's for drug users or for couples trying to have children. There's lots of different reasons that somebody might be on PrEP. Basically anybody that wants to remain HIV negative. All right, so hopefully that video covered the basics enough for everybody. If you have any questions about any of that content, feel free to leave a comment on this video or contact myself or your educator directly. We would love to help you answer some of those. So now that we've covered what HIV is, we want to talk about why it's linked to our nutrition. So if you are HIV positive, good nutrition can have several benefits. It can improve the overall quality of life by providing nutrients your body needs. It can keep your immune system strong so you can better fight other diseases. It can help manage HIV symptoms and complications, which we're going to dive into more. And it can help process your medications and manage their side effects. So first off, some of the very basic principles. So here we have the My Plate. It's a picture that depicts about how much of each food group we should be eating each day. So what the USDA says about our body is that we should make half of our diet fruits and vegetables. Any of the grains you eat, you want at least half of them to be whole grains, but it could be all the way up to 100% of your grains. You want to consume 3 cups of dairy daily. If you're lactose intolerant or you don't consume dairy, you really just want to make sure that you're hitting your calcium and your vitamin D markers. You want to be limiting your added sugars and your added sodium. And you want to be eating complete meals and snacks that include protein, carbs, and healthy fats. Those are the main building blocks of food. So they're some of the best things to pack into your diet. You may have noticed that there wasn't a bullet point for protein on that slide. There's just a little bit more to be said about it. An average adult needs about 45 to 56 grams of protein a day. However, if you're HIV positive and you have kidney or liver issues, or if you're experiencing muscle wasting, you do want to see a doctor or a dietitian for an appropriate protein recommendation. It may be increased or decreased depending on your body's needs. Across the board, no matter how many grams you're supposed to be eating a day, you do want to do your best to choose lean proteins like fish, nuts, seeds, things like that. So first I want to talk just a little bit about medications. Certain medications may cause you to have to change some aspects of your typical diet. You might want to talk about individual medications with your doctor. Some things to ask about are changes in daily recommended intakes, such as should you be having more calcium, more water, less water. You might want to talk about foods to avoid. For example, lots and lots of medications come with the stipulation that you can't consume grapefruit juice. So you want to look into things like that. Lastly, you might want to look into supplementation. Do you maybe need a vitamin D supplement? Are you not getting enough of B12? Do you need to be on a daily multivitamin? Things like that are things that you might want to discuss with a doctor or a dietitian as well. So now I want to get into very common symptoms that lots of people experience. I want to talk about how nutrition can help cater to these issues and make them a little less irritating to a person. So we'll start with nausea. You want to start by eating a brat diet, nice, soft, bland foods that won't upset your stomach. So typically we think about bananas, rice, applesauce, toast, just anything that won't further upset your stomach. You want to eat smaller, more nutrient-dense meals or snacks every 2 or 3 hours. That way you're not forcing too many calories in and upsetting your stomach further. You want to avoid greasy and spicy foods. Those could, again, further upset your stomach. Drinking ginger tea or consuming ginger in almost any way can help alleviate stomach pain. You also want to focus on cold foods. Eating things that are too hot or too spicy may upset your stomach. And if this is a very common problem, you do want to talk to your doctor about nausea medication. You don't want to be dealing with this on a daily basis. So then we have mouth and swallowing problems. So we're thinking sore throats, thrush, broken or missing teeth, things that are really going to be bothering you. First, you want to start by just eating soft foods. Yogurt, bananas, mashed potatoes. Other suggestions would be pears, peanut butter, bread, things like that. You want to avoid raw vegetables. They're typically a little bit too hard, involve too much chewing. If you go ahead and cook them or buy canned ones, they're going to be nice and soft. You want to stay from acidic foods like oranges, lemons, and tomatoes. That feeling won't feel good in your mouth if you have something like a cut or a broken tooth or a sore throat. You do want to see your doctor to make sure you don't have thrush or another opportunistic infection. You may want more diagnostic testing done if this is a problem you have regularly. Look into things like strep throat. And you also want to remember to visit your dentist regularly if possible. Sometimes your teeth will be the first indicator of problems. So diarrhea is another very common one. If you're experiencing diarrhea, the first thing you want to do is make sure you're drinking more fluids than usual. Try and drink water. If you really can't drink water plain, try and dilute juice. These things will help keep your body hydrated because during a bout of diarrhea, your body is losing a lot of fluids. You want to limit drinks with caffeine. This will just dehydrate you further. Caffeine also has a tendency to push everything through very quickly. You don't want to be adding to that. You want to eat slowly and more frequently because you want to treat your stomach very gently. Right along with that, you want to avoid greasy and spicy foods. Stick to that brat diet I mentioned before, nice, soft, bland, boring foods that'll treat your stomach well. You want to avoid alcohol. It's also going to go right through you and dehydrate you. And if diarrhea goes on for more than 48 hours, you want to call your medical provider. They may be able to supply medication to alleviate some of the symptoms. You mainly want to focus on not dehydrating during this. So then we have the opposite. We have constipation. During constipation, you want to increase the fiber in your diet with foods such as wheat bran, psyllium, whole grains, legumes, which are like beans and peas. You want to eat more fruit and more vegetables. Those things have lots of fiber and helps push things through your body. You also might want to consider dried fruits like dates, prunes, figs, and raisins. Those are extremely high in fiber. You want to drink lots of water. That'll help keep things moving. And you might want to consider warming that water up or drinking hot teas. Those also help break up some of the stuff that's stuck in your tract and will hopefully help loosen your stool and help you go to the bathroom. So then we have lack of appetite. Sometimes due to certain medications, you might not feel hungry for hours at a time. So there's a few different things you can do. First, you can exercise to help stimulate your appetite, get things moving, see if that gets your stomach moving. Avoid drinking too much right before meals. If you drink lots and lots of water throughout the day, it might be hindering your appetite because your stomach is full of water. You might want to try eating or snacking with family or friends. Sometimes eating over a bowl of chips with a dip and chatting is a lot easier than sitting down with a meal and trying to force yourself when you're really not hungry. Try smaller, more frequent meals. It might be encouraging to sit down with only a couple hundred calories in front of you and you may be able to eat it. Do that several times a day instead of just 2 or 3, and you'll still be hitting your caloric needs for the day. You want to include a variety of textures, shapes, and colors into your diet. First of all, that helps make sure you're getting a wide variety of nutrients when you are eating. It also helps trick your body into wanting to try new things, hopefully stimulating your appetite. You might want to consider meal prepping so that you have foods on hand so that when you are hungry, you can eat quickly before your appetite passes. And again, if this is something that happens very frequently, you might want to talk to your doctor about medications to stimulate your appetite. So relatedly, we have unintentional weight loss. So some reasons that this might happen to somebody. Firstly, food insecurity. Somebody may physically not have food in their house for long periods of time. If that's the case for any of my clients, please get a hold of me. We can help with that. Secondly, having HIV can increase your metabolism. So if you're newly diagnosed and suddenly losing a lot of weight, you may have to be eating more calories to accommodate a faster metabolism. HIV can also alter the lining of your gut, making it harder to absorb nutrients. So basically your body's not holding on to as much. Like we just talked about, you may have a loss of appetite, and over time that would lead to an unintentional weight loss. And lastly, you might have symptoms that are making eating difficult. You might have a lost tooth, a sore throat, you might be nauseous or throwing up a lot, and eating is just no longer a very desirable thing to do. So some helpful tips, and these are just a few of many, many tips out there. When you are hungry and you've had unintentional weight loss, try to include more protein, carbs, and healthy fats into your diet. Eat whole foods that are high in calories, high in nutrients to help with the weight loss. You want to eat dried fruits and nuts for snacks. Eating just a very small handful can give your body a really large amount of calories and nutrients. Like I said, if this is an ongoing problem, you want to talk to your doctor about potentially adding a nutrition supplement such as Boost or Ensure or Carnation to your diet. And you also might want to talk to your doctor about medications that stimulate your appetite and or treat nausea. Lastly, I want to talk about lipodystrophy. Lipodystrophy is a problem with the way the body produces, uses, and stores fat. It's also called fat redistribution. Lipodystrophy is not all that common, but what happens is when your body basically takes your fat and allocates it to one spot on your body. So you may see thin people with large stomachs or large arms. You may see fat between people's shoulder blades, like depicted here. So when you do experience that, some ways to help reduce the symptoms are to limit your saturated and trans fats. So try to eat healthy fats like fats in oils and olives and beans and peas and nuts and seeds. Also, other unsaturated fats like the fats in fish and in omega-3s. You want to limit your alcohol and your added sugars. You want to eat fiber-rich whole grain foods and also fruits and vegetables that are rich in fiber. And you want to try and exercise to literally expel the fat. So finally, just a reminder, it's important to remember that if you're experiencing any of these symptoms for longer than 48 hours, that is considered prolonged and you should contact your doctor as soon as you can. If your symptoms become too difficult to manage before that, you should also contact your doctor and make an appointment. If you have any questions about any of the materials we went over today, please contact me or your personal nutrition educator, or go ahead and leave a comment on this video and we will respond. Thank you so much. Have a wonderful day and stay safe.